Tubular secretion. Tubular secretion is an active process where drugs and other substances are transported from the blood into the tubular lumen of the nephron. This mainly occurs in the proximal tubule and involves various transport proteins. Mechanism of tubular secretion. Active transport. Transport proteins in renal tubule cells. These proteins actively move drugs from the peritubular capillaries into the tubular cells. Transporters move drugs against their concentration gradient, which requires energy in the form of ATP. Transporters involved organic anion transporters, OATs. These transport acidic drugs and metabolites such as penicillins and nonsteroidal anti-inflammatory drugs. Organic cation transporters, OCTs. These transport basic drugs, including cimetidine and metformin. P-glycoprotein, PGP, an efflux transporter that pumps various drugs out of cells into the urine. Characteristics of tubular secretion, efficiency. This process can handle both free and protein-bound drugs, making it highly efficient. Drug-drug interactions. Multiple drugs competing for the same transporter can lead to interactions affecting drug levels and efficacy. Factors affecting tubular secretion. Transporter activity. Genetic polymorphisms can affect transporter expression and function, leading to variability in secretion rates. 2. Drug-drug interactions. Co-administered drugs that inhibit or compete for the same transporters can alter the secretion of other drugs. Example of drug-drug interaction. Probenecid and penicillin. Probenecid is a drug that inhibits the secretion of penicillin by blocking the OAT system. This increases the penicillin levels in the blood and prolongs its action. Renal function. Conditions like renal impairment can reduce the efficiency of tubular secretion. For example, in CKD patients, drugs like vancomycin that are mostly cleared by the kidneys can build up to toxic levels, requiring dose adjustments. Tubular reabsorption. Tubular reabsorption is the process by which water, electrolytes, and drugs are reabsorbed in the tubular lumen back into the bloodstream. This can be a passive or active process and mainly occurs in the distal tubule and collecting duct. Mechanism of tubular reabsorption. 1. Passive reabsorption. Lipid membranes. Drugs that are lipophilic, fat-loving, and unionized, not carrying a charge, can easily pass through the lipid membranes of kidney cells. This is because the cell membranes allow lipophilic substances to diffuse through more readily than hydrophilic, water-loving substances. Factors. The efficiency of passive reabsorption depends on the drug's lipophilicity, how well it dissolves in fats, and the pH of the tubular fluid. The more lipophilic a drug is, the more easily it can be reabsorbed. Active reabsorption. Energy requirement. Unlike passive reabsorption, active reabsorption needs energy, ATP. It moves substances against their concentration gradient, from low to high concentration. Transport proteins. This process uses specific transport proteins in kidney cells. These proteins bind to substances like glucose and amino acids and move them back into the blood. Importance. This mechanism helps the body reclaim important nutrients and ions from the filtrate to prevent their loss in urine. Mass pH dependence of reabsorption. Ionization state. The ionization state of a drug affects its reabsorption. Weak acids and bases are reabsorbed differently depending on the pH of the tubular fluid. Weak acids. Drugs like aspirin are reabsorbed more in acidic urine because they remain unionized, nonpolar, and more lipophilic. Weak bases. Drugs like amphetamines are reabsorbed more in alkaline urine for similar reasons. Factors affecting tubular reabsorption. Let's take a look at the diagram to understand the factors affecting tubular reabsorption. Drug properties. Lipophilic, fat-loving drugs are reabsorbed more, while hydrophilic, water-loving drugs are reabsorbed less. 2. Urine flow rate. Faster urine flow means less time for reabsorption, reducing the reabsorption rate. 3. Urine pH. The pH of urine affects drug ionization, which in turn affects reabsorption. 4. Transporter activity. Genetics and drug interactions can change how well transport proteins work. Understanding how our kidneys secrete and reabsorb drugs helps us better manage medications and avoid unwanted interactions. By knowing these processes, we can improve drug therapy and patient care.